Brambach and Dr. Pericatillo for bringing your Men's Drive for Health to our campus, for bringing your Tesla here, but also your great energy and your great passion for what we care about so much as well. It's really an honor to have you here, and we'd love to be participate further, and we're going to follow you through the next 10 days of your trip. Just to introduce myself, I'm a radiation oncologist, and I specialize in the treatment of prostate cancer. Just like in Orlando, as in here, it's the specialty, and it's the men that we care about the most. Just to tell you a little bit about our program, we have a highly specialized treatment in brachytherapy and robotic surgery and external beam radiotherapy, but that just touches on it. What we do is specialize in prostate cancer and with a focus on the individual, on the man, and on the men's health that surrounds it. So I'm going to talk for a couple seconds today just on tips for survivorship, and I'm going to focus mostly on just how diet and exercise influence survivorship. And just in general terms, when you have a positive diet, when you have a positive workout session, a physical exercise routine, you're more likely to survive cancer. You're more likely to tolerate treatment. You're more likely not to have the side effects that go along with cancer therapy, whether it's surgery or radiation or chemotherapy in the traditional sense, and you're more likely to have a high quality of life long term. And how we approach that is with a very large team. When you visit us here at Winship Cancer Institute, like many of the NCI designated cancer institutes in the United States and cancer centers in the United States, it starts with the excellence in care of nursing and oncology nursing, the courteous for staff that creates a positive environment for you. It has to do with the nurse navigator support that can help a patient be directed from beginning through survivorship, the expertise on staff from pathology and radiology and all the supportive staff through the surgical professions, the radiation oncology and chemotherapy. And along the way, you'll generally meet a nutrition or dietitian or an expert in these areas. And what I want to focus on is just a few key points to you today. One is diet matters. When you adapt a diet for survivorship, you are going to improve your quality of life. You may live longer, and it's really focused on a diet that goes for the good things, and I kind of generalize it in a Mediterranean diet, and the good things being healthy, whole foods. Simple tips are shopping the outside of a grocery store and avoiding the stuff on the inside that is more processed, has more preservatives, stuff that is higher in animal fat. And we like to focus towards such products as soy, such products as tomatoes, such products like turmeric, that we've studied these nutraceuticals and know that they benefit our patients. And those are benefits you can see actually every day in people undergoing treatment. And this is clinically proven to prolong life. And then the second thing I want to talk about is exercise, and very simply, any activity benefits our patients. Just being outside like this and absorbing and processing for your vitamin D is an important point to healthy survivorship. But the data supports this. It is not even an arguable point. When people just walk 20 minutes a day, or get in a pool for a little bit of time, or do something deliberately, not to be a marathon runner, but just to get their heart rate up a little bit, they are going to benefit themselves. And there are such things as studies we've done and completed where 14,000 men went through this prevention test, and when we were looking just at whether they did something for 2 or 3 hours a week versus were doing nothing, they had a 30+% chance reduction in their recurrence of prostate cancer just in that alone. And so we know that the benefits are profound, and that's what we want to relay to our men and to their families for their survivorship. So that's my message today. Thank you for your time, and I can field any questions as well.